Malaria by Stephanie Elder, Sarah Hulsey, Tammy Hernley, and Jessie Cobb. Who discovered malaria? Sir Ronald Ross was born in India in 1857. He was later sent to England by his parents to get his education. At first, Ross had no interest in the medical field. At the age of 17, he followed his father's wishes and entered medical studies. In 1892, he became interested in malaria, which he originally doubted the parasite's existence. He then believed that malaria parasites were in the bloodstream when this was demonstrated to him by Patrick Manson in 1894. In 1902, he was awarded the Nobel Prize for Medicine for his work on malaria, by which he has shown how it enters the organism and thereby has laid the foundation for successful research on this disease and methods of combating it. While Ross is remembered for his malaria work, this remarkable man was also a poet, amateur musician, mathematician, epidemiologist, sanitarian, editor, novelist, dramatist, composer, and artist. He died after a long illness at the Ross Institute on September 16, 1932. Malaria. Malaria is a mosquito-borne disease caused by a parasite. The blood-stage parasites are those that cause the symptoms of malaria. When certain forms of blood-stage parasites are ingested during blood feeding by a female Anopheles mosquito, the parasites mate in the gut of the mosquito and begin a cycle of growth and multiplication in the mosquito. After 10 to 18 days, a form of parasite called a sporozoite migrates to the mosquito's salivary glands. How malaria is transmitted. When the female Anopheles mosquito takes a blood meal on another human, anticoagulant saliva is injected together with the sporozoites, which migrate to the liver. When the sporozoites migrate to the liver, this begins a new cycle. The infected mosquito carries the disease from one human to another, known as a vector, while infected humans can transmit the parasite. Malaria is most often found in Africa, Southern Asia, Central America, and South America. The highest transmission is found in Africa, south of the Sahara, and in parts of Oceania. Temperature is particularly critical for the growth cycle to be completed. Malaria is transmitted in tropical and subtropical areas. Symptoms of malaria include shaking and chills, headache, cough, muscle aches, tiredness, nausea and vomiting, diarrhea, rapid heart rate. Patients may also experience anemia and jaundice, which is yellow coloring of the skin and eyes because of the loss of red blood cells. Neurologic complaints such as dizziness, confusion, disorientation, and coma can also affect certain patients. Diagnosis of malaria. Microscopy remains the gold standard for laboratory confirmation of malaria. This method uses a blood smear using a stain known as Giemsa and examined with 100 times oil immersion objective. This method is used to detect malaria parasites and to differentiate, when possible, the various species. CBC with differential can be used if Giemsa is not available, but species identification might be a bit more difficult. Rapid Diagnostic Test, or RDT, is a quick way of establishing a diagnosis of malaria infection by detecting specific malaria antigens in a person's blood. RDTs have recently become available in the U.S. This technique takes about 15 minutes for a result. All positive RDTs should be followed by microscopy. Indirect fluorescent antibody test, or IFA, is also used to detect antibodies, but is not practical for routine diagnosis of acute malaria because the amount of time this test takes. Treatment of malaria. Treatment of malaria depends on many factors, including disease severity, the species of parasite causing the infection, and the part of the world the infection was acquired. Additional factors such as age, weight, and pregnancy may limit the available options for malaria treatment. Treatment should be guided by the following four main factors: infecting Plasmodium species, clinical status of patient, expected drug susceptibility of the infecting parasite as determined by the geographic area where the infection was acquired, previous use of antimalarials, including those taken for malaria chemoprophylaxis, Patients with malaria are treated with anti-malarial drugs. For severe cases, treatment includes IV artesunate. Pregnant women are 3 times more likely to develop severe disease than non-pregnant women who acquire malaria in the same geographic area. Incidence. The CDC helped eliminate malaria as a major public health problem in the U.S. in the late 1940s. However, approximately 2,000 cases are reported each year in the U.S. Most of these cases are in returning travelers and immigrants. Anopheles mosquitoes capable of transmitting malaria, known as vectors, exist in the U.S. Thus, there is a constant risk that malaria transmission can resume in the U.S. To continue to prevent illness and deaths due to malaria, CDC works within the U.S., administering the National Malaria Surveillance System, investigating instances of locally transmitted malaria, preventing malaria among international travelers, providing artesunate for treatment of severe cases of malaria in the U.S., and advising blood collection centers. Patient prognosis. Patients with uncomplicated malaria show marked improvement after 48 hours of initiating treatment and are fever-free after 96 hours. If left untreated, prognosis is poor. Early diagnosis and treatment reduces disease and prevents deaths and contributes to reducing transmission. Organizations like WHO work tirelessly to eliminate malaria from those areas of high risk. Education and surveillance is key to success at elimination. Over the past 2 decades, 11 countries have been certified by the WHO Director General as malaria-free. Current and future research. Rapid malaria diagnostic testing options are becoming more readily available, making it possible for testing sites to reach more secluded communities. The use of insecticides has gotten better, along with development of long-lasting insecticide treatments for bed nets. The CDC is currently studying these insecticide bed nets for their ability to kill mosquitoes and how long the insecticide lasts. This research will help better predict when to change the bed nets for better protection. Are destructive to parasites is important to the development of these vaccines. Interesting facts about malaria. Among all communicable diseases, malaria is the 3rd largest killer of children between the ages of 1 month and 5 years, following pneumonia and diarrhea. Malaria can pass from human to human. You cannot catch malaria like you can a cold, but people can pass it on by sharing needles, blood transfusions, and through pregnancy. Malaria in pregnancy contributes significantly to deaths of mothers and young children, with an estimated tally of at least 10,000 women and 200,000 infants under 1 year old. Sleeping under insecticide-treated bed nets, or ITN, is the most common and most effective way to prevent malaria infections. In 2016, an estimated 54% of people at risk of malaria in sub-Saharan Africa slept under an ITN compared to 30% in 2010. In 2019, there were an estimated 229 million cases of malaria worldwide. The estimated number of malaria deaths stood at 409,000 in 2019. The word malaria means bad air. In the 18th century, people thought that malaria was caused from breathing in bad air in marshy areas. In 1880, scientists discovered that this was not true, but the name